Hi, how are you?
Hello, how are you? Doing good?
Wonderful. Look, Dr. Napolitano, you are an optometrist. Tell us a little bit, because as people who are not optometrists, on one hand, every optometrist to us, to a certain degree, looks the same, and at the same time, we're a little bit worried that maybe not every optometrist is the same. So tell us a little bit, what can a person expect walking into your practice?
Well, optometrists are your primary eye care provider. So it's just like going to your family doctor when you have a cold or you have the flu. And then if there is more treatment that is needed, for example, if you have severe diabetes in the eye, so if you need a surgery, then we will refer you to the appropriate specialist, just like your primary care does. If you have heart problem, they will send you out to see a cardiologist. So we are primary eye care providers. We do full eye exams, we dilate the pupils, we make sure the retina is in good health, we look for cataracts, we do the glaucoma test. We also treat the conditions of the eye, like dry eyes, allergies, things of that nature, inflammation. Yeah.
And obviously you prescribe the correct glasses or lenses, right?
Right. We also prescribe eyeglasses or contact lenses. We do contact lens fitting. Right.
Regardless of whether a person is needs reading glasses or is nearsighted or is farsighted.
We check for everything.
So there's a lens and or a glass for everything.
For everything. Yeah.
And even if a person is considering, let's just say, surgery, LASIK surgery or some such stuff, he's still well off coming to you, get the basic information, because you're aware of all the things which could or could maybe not be done. And then if the person's desires, instead of taking classes to take some surgery, you can give him the opinion, refer him to a surgeon, and from there he gets his second opinion and gets some more detailed information about that stuff. Am I right there?
Correct. We are also affiliated with the LASIK Center that is located in Garden City, right around us. So what we do is we do the pre-surgery visits, and we also do post-surgery visits. So after the surgery, you're going to need some follow-ups, and you will come to us to do that.
Got it. So there was some surgery follow-up, which quite often, can be done by you. Wonderful. Now let me ask you, when it comes to the eye, you're dealing with young people as well as with old people, or does that make any type of difference? Is there a different optometrist needed for children versus normal adults or versus people who are in their later years?
We see patients of every age. We don't see infants, but we do see from 3-year-olds to 100 if needed. We do the elderly population, the young population. We have our patient base is divided among ages. We see patients of every age.
Got it. Even though we'll talk a little more specific about it, but what's a normal age where a mom should bring her children to an optometrist?
Well, the first eye exam should be at 9 months of age. That's what recommended by the American Optometric Association. After that, once the first eye exam is done, as long as everything is normal and nothing gross is observed about the child, excessive squinting, getting too close to objects, eye turns, then I would say by the age of 5, before they start school, they should definitely have an eye exam.
Well, all right. Okay, good. Now, Dr. Napolitano, question. What made you becoming a optometrist?
Well, that's actually a very interesting story. My dream was always to become a veterinarian. But after I worked for an animal hospital for many years, I decided that it was not the appropriate field for me. I just could not deal with putting the animals to sleep. Therefore, I started working for different healthcare providers, and I stumbled upon optometry. It was pure chance, because I'm actually originally from Italy, and in Italy we do not have optometrists. We don't have such profession. So here I stumbled upon the optometry profession. I fell in love with it, and I decided to go through with it, and I will do it all over again. I love my job. I'm very passionate. I'm very happy with what I do.
Absolutely wonderful. Well, all right, here you have it. Dr. Napolitano, thank you very much, and we'll be talking more details about all the different eye problems which can occur. Bye-bye.
Thank you, Mr. Clark.